हेलो गुड मॉर्निंग, मैं सिर्फ डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सब इंपॉर्टेंट एमसीक्यू। अ 50-year-old मेल प्रेजेंट टू द इमरजेंसी डिपार्टमेंट विद डिफ्यूज चेस्ट पेन एट रेस्ट. He says the pain radiates to his left shoulder and is relieved when he sits up. A scratchy sound that persists when the patient holds his breath in heard on cardiac auscultation along with normal S1 and S2. What is the most common etiology of the presentation? The clinical feature of diffuse chest pain at rest that are relieved on sitting up, radiation of pain on the left shoulder, and the presence of scratchy sound on auscultation uh, means the pericardial friction or rub are typical of pericarditis. Pericarditis can have various causes, and the most cases the exact common remain unknown. This idiopathic pericarditis is the most common. Next question. A 42-year-old female present to the ER with a progressively worsening shortness of breath and chest discomfort for the past week. On examination, distant heart sound, elevated jugular venous pressure with blood pressure 80/60 mm are noted. ECG shown low voltage QRS complex. What is the most likely diagnosis? Acute myocardial infarction, acute pericarditis, cardiac tamponade, and pericardial effusion. The finding of Beck's triad, distant heart sound, elevated jugular venous pressure, and hypotension indicate is the cardiac tamponade. The low voltage QRS complex on ECG are seen in both tamponade and pericardial effusion. Blood pressure is the differentiated factor. Is differentiated factor. Next question. You are an intern measuring the blood pressure in the ER. You notice inspirative fall of systolic blood pressure more than 12 mmHg. Which of the following conditions will not show this finding? Pregnancy, constructive pericarditis, pericardial effusion massive, and massive pulmonary embolism. Now, the pericardial effusion massive is the answer because the inspirative fall of more than 10 mmHg indicates pulsus paradox. Pulsus paradoxes. It's seen in cardiac tamponade but not in pericardial effusion. Tamponade causing diastolic collapse of ventricle, causing severe hypotension and a fall of the systolic blood pressure. Next question. A 45-year-old male come to the emergency department with complaints of chest pain and dyspnea. He claimed that dyspnea improves in an upright position and once while lying flat. There is no history of recent illness. The physical evaluation showed positive heart sign. Low voltage ECG was observed. Chest X-ray revealed water bottle hurt. What is the most likely diagnosis? Here the feature given in the question are compatible with the diagnosis of the pericardial effusion. What sign in the dullness to percussion at the base of the left inferior scapular border in conjugation with the tubular breath sound. And echography. Echophony, the echography is a unique finding to pericardial effusion. Echophony. It is a fluid accumulation pericardial space more than the 50 ml. And in electrical alterance, not the duration but the amplitude of a QRS changes due to distortion of the electrical vectors caused by the swirling motion of the heart in pericardial effusion. And the next question, identify the false statement regarding right ventricular failure. The normal JPP is normal. The answer is not correct. Thank you and keep revising.